Hey guys, Dr. Andy here. Today I want to talk about wrist pain in our rotational athletes. So that would be like a golfer and a tennis player, even a baseball player, anything that kind of requires a lot of rotation during your sport of choice. Okay, so in this area we do see tons of golfers and tennis players, so kind of more specific towards them. So whenever we have our patients who are coming in and they have these type of injuries, it's really important, number one, to figure out exactly what is causing the problem, because the wrist is very mobile, so there are a lot of different things that can go wrong. So most important, number one, we got to figure out what's going wrong with the wrist. It could be instability, meaning way too much movement. That's one of my problems. But also we can have these little tiny bones in the wrist that are just not sitting quite right. Okay, so whenever we have a new wrist problem, we do take a really good time to look at the wrist mobility, the elbow, even the shoulder, and we're going to take a good look at all of these muscles all the way on up through here. If it's a mobility problem, usually that means that these little joints that are kind of sitting in the wrist are just not sitting quite right, and we do have to provide a good mobilization or good manipulation for that wrist. And then on top of that, we're going to do some exercises to strengthen that area so that we can kind of lock it down. Another good technique that we might do for it is dry needling. Dry needling, we use these little tiny acupuncture needles, and we're going to use it in the wrist and even all the way up into the forearm, because all of these muscles that start at the elbow come down into the wrist and control your fingers, all right? So we can have wrist pain and the problem being all the way up here at the elbow, okay? So we work and try and work on the entire region, right? So if it's an instability issue, what that basically means, like me, it's one of my main problems, is that we have far too much mobility in the wrist. And what that means is that as we start to go through flexion and extension, there's just far too much motion in the little joints or the little bones that are inside that wrist joint right through here, right? And even side to side, as we go like that with Miss Katie, she's just like me. There's almost a little too much motion in those joints. And our primary job when we have too much wrist mobility, too much, meaning it's actually unstable, is that we are going to work pretty hard with Mr. Connor in our exercise room, in our rehab room, to strengthen the wrist, strengthen the elbow, and start to work on this entire kinematic chain so that we can start to stabilize that wrist so we don't go out there and we don't hurt ourselves. Because as we are playing golf and as we're playing tennis, there's so much rotation, there's almost like so much whipping motion through our swing that area starts to get stretched, and those bones can start to move around a little too much, and that will start to cause a lot of our pain, all right? So either way, whatever's causing your pain, whether it's a mobility problem or too little mobility or too much mobility, like it's unstable, we just have to figure out exactly which one it is, and then we know exactly what to do. So if you are dealing with any wrist pain, especially if it's related to rotational athletes or rotational sport like tennis and golf, let us know. We'll be happy to take care of it for you. Always remember to live with passion, not pain.